Good afternoon, teachers and classmates. Our discussion for today are some of the fields of the subject, discipline, and ideas in applied social sciences. So, in this discussion, we will going to tackle 5 different topics. Success as a therapist is not found in doing something for the client, but rather in being someone for the client. Ely Rivera Walter. In Module 5, the first 2 topics that we will going to be discussed are about value rights, responsibilities, and accountabilities, and the ethical and unethical behavior among counselors. The first topic is about the value rights, responsibilities, and accountabilities with the objectives. Understand the practice of counseling professions by knowing the rights, responsibilities, and accountabilities, and value the importance of the work of a counselor. What is counseling? It is the process of assisting and guiding clients, especially by a trained person on a professional basis, to resolve especially personal, social, or psychological problems and difficulties, or the professional guidance of the individual by utilizing psychological methods, especially in collecting case history data using various techniques of the personal interview and testing interests and aptitudes. Okay, so this is the process na ginagawa sa isang tao ng mga professional and trained persons when this person is facing some kinds of problems and difficulties such in personal, social, or psychological. Ito yung process na isa sa tumutulong sa kanila. How about the counselor and the counselee? A counselor is a person who is specifically trained to provide advice or a person who gives advice in counseling, while a counselee is a person or a client who is being professionally counseled. Okay, so ito yung mga professional persons na tumutulong sa isang tao when it comes to their lives. Kumbaga, parang sila yung nagiging guide ng tao when they're facing some kinds of problems and difficulties in life. And a counselee is yung client ng counselor who is in need of being counseled. Counselor and counselee have different rights, responsibilities, and accountabilities. What are these? Rights of a counselor: maintain a reasonable level of current knowledge and skills in their therapeutic practice. Okay, so karapatan nilang ibigay or gawin or gamitin ang skills nila sa client nila. And karapatan din nilang ibigay and i-share lahat ng alam nila kung paano ma-treat yung isang client. Next, counselors have the right to respect by their client. Okay, so they also have the right to be respected, especially ng clients nila kasi hindi porket binabayaran sila, pwede na silang bastusin. Karapatan pa din nilang i-treat ng maayos. And lastly, understanding of confidentiality and the limits of duty care. Okay, so karapatan nilang respetuhin yung personal time nila and yung confidentiality and privacy nila kasi hindi naman 24/7 silang magsisilbi sa clients nila. Meron din silang personal time na kailangan sundin for their other business. How about the rights of a counselee? Respect its confidentiality or privacy. Okay, so karapatan nilang mabigyan ng privacy and confidentiality kasi hindi naman lahat ng tungkol sa kanila ay dapat malaman ng iba or kahit ng counselor nila kasi may limits and for personal din yun. They should have boundaries for themselves. Receive human care and treatment and consideration. Okay, so karapatan nilang mabigyan ng right treatment because nagbabayad din naman sila ng tama. And kaya nga sila lumapit sa counselor kasi alam nilang mabibigyan sila ng right treatment and care doon. Ask questions about your counselor or other services from it. Okay, so rights nilang mag-ask about their treatment and other stuffs about them being counseled. Okay, so kasi syempre, karapatan din nilang magkaroon ng kaalaman tungkol sa condition nila and for their details or important information, kailangan alam nila kasi sila yung kina-counsel. So, dapat as a counselee, alam din nila kung ano yung dapat din nilang gawin. So, they have the rights to ask. And lastly, decline to answer any questions you don't want to disclose any information. Okay, so rights nilang mabigyan ng privacy when it comes to any information kasi sa kanila pa rin nakabase yung pagsagot nila sa tanong ng counselor nila. Sa kanila pa din nakabase kung ano yung mga information na gusto lang nilang i-share sa counselor nila. Responsibilities of a counselor: respect and safeguard the client's right to privacy and confidentiality. Okay, so kapag may sinasabi sa'yo yung client mo, kahit ano man yan, you need to secure it. Kasi kaya niya nga sinabi yan sa'yo because your client trusts you and kampante siya na hindi mo ipagsasabi yung nalaman mo tungkol sa kanya. They should understand the client's culture or background. Okay, so as a counselor, dapat alam mo yung culture or background niya. Why? Para alam mo din kung paano siya papakisamahan at kung ano yung pwedeng gawin para mabigyan mo siya ng tamang treatment. They should know their limits or boundaries as a counselor to their clients. Okay, so dapat alam mo or dapat as a counselor, alam mo kung saan ka lang lulugar. Alam mo dapat yung limitations and boundaries mo kasi once na may masabi ka or magawa ka na makaka-trigger sa kanya, pwedeng maapektuhan yung process ng counseling nyo. And lastly, counselors communicate the parameter of confidentiality in a culturally competent manner. Okay, so dapat alam mo kung paano ka makikipag-communicate sa kanya, especially kapag masyadong sensitive na sa kanya yung pinag-uusapan nyo. Kasi then as a counselor, kung hindi mo na alam kunwari yung pwedeng gawin sa kanya para magamot siya, you can refer your client na already to other authority. Responsibilities of a counselee: provide a complete information about one's illness or problem to enable proper evaluation and treatment. Okay, so dapat you give enough information to your counselor about yourself para mas madali sa kanilang mapag-aralan at maisip kung ano yung dapat nilang gawin sa'yo as your counselor. Show respect to their counselor and other patients. Okay, so you should know how to respect your counselor nor other patients kasi client ka lang naman. Kailangan mong makisama ng mabuti para wala kayong maging problema as well to the other patients kapag nagka-counsel kayo. Ask questions to their counselor in order for them to know their condition. Okay, so ugaliin mo na magtanong or dapat lagi kang nagtatanong sa counselor mo for you to know your condition and sa kung ano yung dapat mong gawin. And lastly, inform their counselor about their condition or any reaction occurs from medication. Okay, so dapat nag-a-ask ka dun sa or ini-inform mo yung counselor mo dun sa nagiging reaction ng body mo or ng sarili mo dun sa medication and treatment na ginagawa ninyo para kapag kung may problema man na mag-appear while nagme-medicate ka, masusolusyonan agad ng counselor mo. Accountabilities of a counselor: being responsible for the client's condition. Okay, so as a counselor ng client mo, responsibilidad mo yung condition niya kasi ikaw lang naman yung nakakaalam ng treatment niya, walang iba. Accountable for the client's treatment and care. Okay, so as a counselor niya, responsibilidad mo na bigyan siya ng treatment and care kasi ikaw yung naging counselor niya, so dapat tutulungan mo siya na mag-grow sa pamamagitan ng pagbigay sa kanya ng good treatment and tamang pag-aalaga. Our second topic is about ethical and unethical behavior among counselors with the objectives: identify ethical principles and behaviors expected of a counselor and value the importance of acquiring proper behavior required of a counselor. What is ethics? It represents the moral code that guides a person's choices and behaviors throughout their life. How about the ethical and unethical? Ethical is defined as moral or conforming standards of conduct, and unethical is not conforming to a high moral standard. What is Code of Ethics? It helps counselors to remind them their rights, responsibilities, and accountabilities in a counseling session. Code of Ethics is divided into 8 different sections. These are Section A, the counseling relationship; Section B, confidentiality, privileged communication, and privacy; Section C, professional responsibility; Section D, relationships with other professionals; Section E, evaluation, assessment, and interpretation; Section F, supervision, training, and teaching; Section G, research and publication; and Section H, resolving the ethical issues. Section A, the counseling relationship. Counselor's primary responsibility is to ensure his or her client's dignity and welfare. Counselors should keep sufficient and timely records, and this should reflect client's progress as well as different services provided by the counselor. Section B, confidentiality, privileged and communication, and privacy. Counselors should respect the rights of their clients. They should respect their clients' privacy, and they are only allowed to share a client's information with others when they have the client's consent. In addition, counselors should know their limitations and boundaries. Section C, professional responsibility. Counselor's responsibility is to read and comprehend the ethical codes and standard of the profession. Counselors should practice counseling based only on their education, training, and professional credentials, as well as their professional experience. Section D, counselors' relationships with other professionals. Counselors need to respect others providing counseling approaches different from their own, and they should strengthen their relationships with other colleges in order to provide the best services for their client. Section E, evaluation, assessment, and interpretation. Counselor's responsibility is to select reliable and valid instruments to measure a client's personality, ability, interest, intelligence, or performance. In addition, counselors must know how to interpret the assessment results. Section F, supervision, training, and teaching. Counselors serve as supervisors to their clients. They are responsible for their supervisees' understanding and following of ethical codes. In addition, supervisees must explain to their clients who will have access to the client's record. Section G, research and publication. When counselors are conducting research, they must report their research following ethical principles and federal state laws as well as the regulations of the host institution. When counselors recruit humans as research participants, they must avoid harming these psychologically, emotionally, or physically. And lastly, Section H, resolving the ethical issues. Counselors should be knowledgeable regarding the ACA Code of Ethics and codes of other licensure organizations. When they face ethical dilemmas, they should consult colleges or supervisors. If the conflict exists between ethics and law other regulations, counselors should take the appropriate steps to resolve the conflicts. And now, we will going to proceed in Module 6 with 3 different topics. The first topic is the clientele of counseling, with the objectives: describe the characteristics of clientele and audiences of counseling, explain the needs and various types of clientele and audiences of counseling, and analyze the importance of the client's perspective in a counseling process. What are the clientele and audiences of counseling? The clientele and audiences of counseling are normal people. They are not in need of clinical or mental help. They are just simply seeking to achieve a goal. They may be the youth in need of guidance at critical moments of their growth, or anyone in need of realizing a change in behavior or attitude. What are the needs of various types of clientele and audiences of counseling? 1. A school guidance counselor provides the need for personal guidance by helping students seek more options, and a counselor who may serve as bridge between family and school in resolving conflicts that affect students and families. Counselors have different roles. These are job hunting coaching, conflict management, human resource personnel, marriage counselor, drug abuse and rehabilitation, bereavement counselors, and abused children. Job hunting. Counselors provide avenues for people to find necessary information and get employment that is suitable to them. Conflict management providers provide the need for principles and theory-based approaches to deal with conflict constructively. Human resource personnel provide the needs common to all workplaces and to deal with various employee needs that cover aspects, social services, compensations, and conflict resolution and discipline. Marriage counselors provide the need for conflict resolution skills to parties, couples, and children to deal with various stresses and issues that threaten their unity or peaceful coexistence. Drug abuse and rehabilitation meet the need to help people overcome their problems or mitigate some of the most negative effects of drug abuse. Bereavement counselors respond to the need to be helped to go through loss such as death of the family. Abused children counselors meet the need to facilitate processing and restoration of abused children through recognition and implementation of existing laws and recovery procedures. The second topic to be discussed is the process and methods of counseling. The objectives are illustrate the different processes and methods of counseling and distinguish the process of counseling from methods of counseling. What is counseling process? It is a cooperative process in which a trained professional helps a person call the client to identify sources of difficulties or concerns that he or she is experiencing. There are 5 steps in counseling process. Step 1, relationship building. Step 2, problem assessment. Step 3, goal setting. Step 4, counseling intervention. And step 5, evaluation, termination, or referral. Step 1, building relationship. The first step involves building a relationship and focuses on engaging clients to explore issues that directly affect them. The first interview is important because the client is reading the verbal and nonverbal messages and make inferences about the counselor and the counseling situation. Step 2, problem assessment. This step involves the collection and classification of information about the client's life situation and reasons for seeking counseling. Step 3, goal setting. Goals are the results or outcomes the client wants to achieve at the end of the counseling. This is where goals play an important role in giving direction. Step 4, counseling intervention. There are different points of view concerning what a good counselor should do with clients depending on the theoretical positions that the counselor subscribes to. And lastly, step 5, evaluation, follow-up, termination, or referral. Terminating the counseling process will have to be conducted with sensitivity, with the client knowing that it will have to end. And the last topic that we're going to discuss is the needs of individuals, group or organization, and community with the objectives to differentiate the concept of needs of individuals, groups, organization, and communities, and to describe the needs of individuals, group, organization, and community as a client in counseling. There are 3 types of client in counseling. These are the individuals, groups or organization, and the community. Individual, the individual who needs to be helped to manage well a life-changing situation or personal problem or crisis and other support needs may undergo counseling. Group or organization, group in communities, organizations, students in schools, teachers, departments in workplaces, and such an entity can undergo group counseling. And lastly, community. When people experience something collectively which may be socially troubling and constitute the danger of blocking their collective capacity to move on, counseling is necessary to be undertaken on a community level. Thank you guys for listening. Hope you have learned something from us. Have a nice day.